This presentation illustrates the concept of primary healthcare and its principles. Primary healthcare is essential healthcare that is a socially appropriate, universally accessible, scientifically sound, first-level care provided by a suitably trained workforce, supported by integrated referral systems and in a way that gives priority to those most in need, maximizes community and individual self-reliance and participation, and involves collaboration with other sectors. It includes the following: health promotion, illness prevention, care of the sick, advocacy, and community development. In other words, PHC is an approach to health beyond the traditional healthcare system that focuses on health equity producing social policy. PHC includes all areas that play a role in health, such as access to health services, environment, and lifestyle. Primary healthcare entails the first level of contact between the individual and the health system. Essential health care is provided. A majority of prevailing health problems can be satisfactorily managed. The closest to the people, it is provided by the primary health centers and covers regular medical treatments. Apart from regular medical treatments, PHCs in India have some special focuses. Infant immunization programs. Immunization for newborns under the National Immunization Program is dispensed through the PHCs. This program is fully subsidized. Anti-epidemic programs are also covered under regular medical treatments. The primary health cares or PHCs act as the primary epidemic diagnostic and control centers for the rural India. Whenever a local epidemic breaks out, the system's doctors are trained for diagnosis. They identify suspected cases and refer for further treatment. Next is birth control programs. Services under the National Birth Control Programs are dispensed through the PHCs. Pregnancy and related care. A major focus of the PHC system is medical care for pregnancy and the childbirth in rural India. This is because people from rural India resist approaching doctors for pregnancy care, which increases neonatal death. Hence, pregnancy care is a major focus area for the PHCs. And lastly, emergencies. All the PHCs or primary health care centers store drugs for medical emergencies which could be expected in rural areas. For example, antivenoms for snake bites and rabies vaccinations, etc. Primary health care became a core policy for the World Health Organization with the Alma-Ata Declaration in 1978 and the Health for All by the year 2000 program. The commitment to global improvements in health, especially for the most disadvantaged populations, was renewed in 1998 by the World Health Assembly. This led to the Health for All for the 21st century policy and program within which the commitment to PHC development is restated. Functions of primary health care include provision of medical care, maternal child health including family planning, safe water supply and basic sanitation, prevention and control of locally endemic diseases, collection and reporting of vital statistics, education about health, national health programs as relevant referral services, training of health guides, health workers, local DIs and health assistants and basic laboratory workers. The ultimate goal of primary health care is better health for all. The WHO has identified 5 key elements to achieve that goal. Reducing exclusion and social disparities in health, organizing health services around people's needs and expectations, integrating health into all sectors, pursuing collaborative models of policy dialogue. The principles of primary health care are equitable distribution. According to this principle, primary care and other services to meet the main health problems in a community must be provided equally to all individuals irrespective of their gender, caste, age, color, urban or rural location and social class. Community participation. In order to make the fullest use of local, national and other available resources, community participation was considered sustainable due to its grassroots nature and emphasis on self-sufficiency as opposed to targeted or vertical approaches dependent on international development assistance. It also includes intersectoral coordination with states that health cannot be improved by intervention within just the formal health sector. Other sectors are equally important in promoting the health and self-reliance of communities. These sectors include at least agriculture, education, communication, housing, public works, rural development, industry, community organizations. Besides this self-reliance, people's involvement in the planning and implementation of health programs and appropriate technology are equally important to primary healthcare system in India. In addition to this, team approach, decentralization, effective referral systems are also important elements of this approach. The services under primary healthcare are to be made accessible and available to people as per the principles of universality. It also asserts that the role and responsibilities of the state and recognizes that health is a multifactorial entity and there is a need of multisectoral approach to health. This approach emphasizes complete and organized community participation and ultimately self-reliance of individuals and community towards their own health. Primary healthcare views health as an integral part of socio-economic development of a country. It calls for an integration of preventive, promotive, curative, and rehabilitative health services. Traditionally, it is expected that primary health care should include at least education concerning prevailing health problems and methods to prevent and control them. Promotion of food supply and proper nutrition, adequate supply of water and basic sanitation, maternal and child health including family planning, immunization against major infections, prevention and control of locally endemic diseases, and provision of essential drugs. Current reforms look beyond this basic package towards lifestyle disorders and deal with health of everyone in the community. The 1978 Declaration of Alma-Ata proposed a set of principles for primary health care. PHC should reflect and evolve from the economic conditions and socio-cultural and political characteristics of the country and its communities, and be based on application of the relevant results of social, biomedical and health services, research and public health experience. It should address the main health problems in the community, providing promotive, preventive, curative and rehabilitative services accordingly. It should also involve, in addition to the health sector, all related sectors and aspects of national and community development, in particular agriculture, animal husbandry, food, industry, education, housing, public works, etc. PHC should promote maximum community and individual self-reliance and participation in the planning, organization, operation and control of primary health care, making fullest use of local, national and other available resources, and to this end develop through appropriate education the ability of communities to participate. Be sustained by integrated, functional and mutually supportive referral systems leading to the progressive improvement of comprehensive health care for all and giving priority to those most in need. It should rely at local and referral levels on health workers including physicians, nurses, midwives, auxiliaries and community workers as applicable, as well as traditional practitioners as needed, suitably trained socially and technically to work as a health team and to respond to the expressed health needs of the community. There is a set of core activities under PHC system which were normally defined nationally or locally. According to the 1978 Declaration of Alma-Ata proposed that these activities should include education concerning prevailing health problems and the methods of preventing and controlling them, promotion of food supply and proper nutrition, an adequate supply of safe water and basic sanitation, maternal and child health care, including family planning, immunization against the major infectious diseases, prevention and control of locally endemic diseases, appropriate treatment of common diseases and injuries, basic laboratory services and provision of essential drugs, training of health guides, health workers and health assistants. Reducing access mortality of poor marginalized populations. PHC must ensure access to health services for the most disadvantaged populations and focus on interventions which will directly impact on the major causes of mortality, morbidity, and disability for those populations. It should function to reduce the leading risk factors to human health. PHC, through its preventive and health promotion roles, must address those known risk factors which are the major determinants of health outcomes for local populations. PHC is also involved in developing sustainable health systems. PHC as a component of health systems must develop in ways which are financially stable, supported, sustainable by political leaders, and supported by populations served. The basic requirements for PHC include the 8 A's and 3 C's. 8 A's are appropriateness, whether the service is needed at all in relation to essential human needs, priorities and policies. The service has to be properly selected and carried out by trained personnel in the proper way. Adequacy, the service proportionate to requirement, sufficient volume of care to meet the need and demand of a community. Affordability, the cost should be within the means and resources of the individual and the country. Accessibility, reachable, convenient services, geographic, economically and culturally accessible services must be sustained. Acceptability, acceptability of care depends on a variety of factors, including satisfactory communication between healthcare providers and the patients, whether the patients trust their care, and whether the patients believe in the confidentiality and privacy of information shared with the providers. And lastly, accountability. Accountability implies the feasibility of regular review of financial records by certified public accountants. The 3 C's are completeness. Completeness of care requires adequate attention to all aspects of medical problem, including prevention, early detection, diagnosis, treatment, follow-up measures and rehabilitation. Comprehensiveness. Comprehensiveness of care means that care is provided for all types of health problems. Continuity. Continuity of care requires that the management of a patient's care over time be coordinated among providers. This was a small presentation on the concept of primary health care. In the next presentation, we will discuss about the approaches to implement primary health care. Thank you.